How has the state changed the way it tests for the Delta variant? And how many children have been among recent cases? Those are just some of the questions asked at today's media briefing with the Idaho Department of Health and Welfare. And our Shira Matsuzawa listened in on that briefing. Shira, what all did they discuss?
Well, Kim, this briefing is part of a bi-weekly meeting that happens, during this pandemic at least. And today, Governor Brad Little also made an appearance on that call saying, with the new school year, we need a renewed effort to getting that vaccine. Now, take a look at some video. The Idaho Department of Health and Welfare Director Dave Jepson said the Delta variant is here and it's currently the dominant variant. And thanks to sequencing, they're getting a better picture of just how dominant that Delta variant is. For example, from mid-May and June, Dr. Christopher Ball says the dominant variant was the Alpha variant, but because they're able to send out more tests and more samples right now, from the middle of June and July, they found more than 80% of the samples being returned were the Delta variant, which means it's widely circulating in Idaho right now, and that this variant is much more transmissible.
Observed is that a person who was infected with the virus went on to infect, on average, somewhere between 2 and 3 people. However, recent studies of outbreaks associated with people who have been infected with the Delta variant have indicated that when that person is infected, they will in turn infect somewhere between 5 and 9 people. One way to think of this is that the Delta variant is at least twice as contagious as the variants that have circulated recently in Idaho. So that's very concerning.
Now, here in Idaho, they have not seen an increase in pediatric hospitalizations like some other places in the country. However, Dr. Catherine Turner, who you just heard from, says they are seeing a difference with identified infections, meaning kids ages 0 to 4 years old. Their case counts have increased about 200% in the last 2 weeks, and it's the same for those 5 to 12 years old. They're seeing a double in the numbers. They believe that could be because of the circulation of the Delta variant, and she adds kids up to age 11 are the most vulnerable population right now since there isn't a vaccine for them. So it's up to older adults to cocoon these kids by getting the vaccine. And that's why the response has changed, which includes, those mask recommendations that we've been hearing about. And with school starting up again, they have convened a back to school task force that they will be issuing some back to school guidance here in the next couple of weeks.
I tell you, I'm wearing my mask again, and some people have said in the newsroom that a couple of Albertsons in the area are requiring masks again. So, I mean, my philosophy is always better safe than sorry, right? I don't want to pass it on to my children. I'm fully vaccinated, but I don't want to pass it on to them.
Absolutely, and that's what we're seeing a lot of businesses do as well. So it'll be interesting to see what happens.
Shira, thank you.